In this video, I'm going to let you know what do paramedics do when we come across bad and shitty EMTs. Check it out. So imagine pulling up to a scene, you're being called for backup, and you have this overzealous EMT approaching you, letting you know that the person is hypotensive, tachycardic, hyperglycemic, they fell down, they hit their head, and they're having syncopal episodes, and it's like this thing where he's got a smile on his face, letting you know that this person's in critical conditions and we better hurry up. Okay. No problem. We've been here before. Everything you mentioned, we can help with that. And we can expedite transport to the hospital, which is the ultimate treatment. As we're walking towards the ambulance, there's a car that was stuck. That car that was stuck, the person was waiting. And guess what this overzealous EMT does? He knocks on the window super hard and super abrasive in the Bronx, and letting the person know he better wait because we're not going to be moving anytime soon. Lack of professionalism, being imprudent, and unnecessary aggression towards a bystander pretty much who's waiting. And in this video, I want to define to you what makes a bad EMT and what do paramedics do when we come across these bad EMTs. And I'm going to define a bad EMT for you at the end of this video. But what I want to do right now is tell you what do we do and what did I do on this particular situation. As soon as I set eyes on the patient, I came to realize that this patient was in stable condition. I asked him what was his problem. He said his elbow hurt. His blood pressure was normal. So were his other vital signs, except that he had hyperglycemia because he was a diabetic who had one too many beers. But he was sober. Alert-oriented times person, place, and time. And his only complaint was elbow pain because he had fell down. And the reason why I bring this up, my people, is because as soon as I got this information from him in less than 30 seconds, I said, let's go to the hospital. I'll do whatever I have to do on the way to the hospital. And the reason why I expedited the transport to this nearest facility was because I didn't want to be around the EMT. So if you're a paramedic or you have a paramedic expedite their exposure to you, it's most likely because they're trying to avoid you. So if you ask me, what do paramedics do when they come around and be around EMTs or scenarios where they're not comfortable? They fucking leave. I bounce. I don't stay and play. If I go to an apartment and it's shitty, or they smoke too many cigarettes, or they have dogs and there's dog shit and feces, what do? I expedite the transport. Same thing I did with this EMT guy who was acting overzealous. It was obvious that he's not from the New York City and he's from New York State, but outside where they don't have much emotional intelligence. Not in all cases, but in the majority of people you meet, they have lack of emotional intelligence. Now, to define what a bad EMT is, and this is no way, shape, and form putting him down, because at the end of the day, we're all brothers and sisters and we're doing the same job. But if you're not good at doing your job, you got to raise your hand and at least be conscious of it. Because the first step to fixing any problem is to know that you have that problem. If you want to fix alcoholism, you can't be in denial about your alcoholism. That's the first step. So what makes a bad EMT? Basically, a person who doesn't give a fuck. 90% of this job is actually giving a fuck about your patients. A person who's in it for themselves is a person who's not a good healthcare provider. A person who's in it for the rush of driving around lights and sirens or having on their fucking checklist that they worked in the Bronx so they can go tell their freaking buddies in the suburbs That makes a bad EMT, because their morals are not aligned with the best patient outcome. They're more just about the notch on their belt. So what makes a bad EMT? A person who does anything and everything that's related to showing and demonstrating that they don't care about their job. That includes, but is not limited to, not providing the best patient care. His problem wasn't that he called for ALS backup. His problem was that he was being abrasive with bystanders, and it was like sarcasm and smiling, which showed that the patient's interest wasn't the most important thing for him. Because if you have a doubt about a patient's vital signs, then by all means call ALS, and whatever ALS didn't approve of your call, then fuck them. Who cares? That's for them to figure out. Any BLS that ever calls me, I embrace them with open arms, because they don't have the amount of training that we have, or he doesn't have the experience I have. So if he has a doubt, I'm there to help. It's not about him calling for backup. It's the things he was doing while in our presence. So once again, my people, what makes a bad EMT is a person who doesn't take under consider empathy. Half the job is actually giving a fuck. Everything else falls into place. I started this job as a high school dropout. All you need is a GED and a high school diploma or a driver's license, and you can work behind the wheel of an ambulance. So that's what I am saying. Having empathy and actually caring about your patients, it's like 90% of the work. The other 10% comes from the training and letting it fall into place. So to all my people out there who are not into becoming a bad EMT, don't do what this person did. Show empathy, show compassion, and take seriously the resources that you have at your disposal. Because he went from being supposedly a critical patient to a patient that was only complaining about an elbow pain. And we were driving lights and sirens towards this person. What if we would have gotten in an accident for this elbow pain? I hope this helps. Peace.